44% of the world's population live in rural poverty, far removed from basic healthcare and education, entrapped in a vicious cycle of suffering, without an ability to improve their lives. Deep-rooted systemic obstacles often prevent sustainable healthcare programs from being developed in these communities. Only limited public resources are available for local healthcare in developing countries. Educational brain drain depletes these countries of the best in human resources. And cultural, political and religious obstacles hamper the reach of non-governmental care. The gap in health inequities suffered by the poor is widening worldwide. The latest statistics are alarming. 1 billion people are without any access to healthcare systems. 11 million children die of malnutrition and preventable diseases every year. And in the past decade, infectious diseases have killed more individuals than all natural and man-made disasters combined. This dramatically growing inequity not only deteriorates these poor communities, but threatens the health of human society as a whole. For human society to survive, a different approach to healthcare is needed. In South India, a sustainable model for healthcare in poor rural communities is emerging. The spirit-centered care of Sri Narayani Hospital and Research Centre of Vellore, Tamil Nadu. It's here that in 1992, the spiritual leader Sri Sakthi Amma appeared with his universal message of healing through selfless service to others. It's hard to imagine that this was a poor and arid land just 16 years ago. Now, Vellore district is home to the beautiful Sri Puram Lakshmi Narayani temple and spiritual park. Nearby, schools and orphanages have been established and are filled with devoted teachers and students. Daily distribution of food, goods and services and other social programs elevate the lives of the most unfortunate. Job training programs and environmental initiatives lead to lasting and sustainable improvements in the lives of the people. And a vivid, growing spiritual community dedicated to the well-being of mankind is flourishing. As part of this spiritual community, and built in a record time of only 8 months, Sri Narayani Hospital and Research Centre opened in 2004 as a full-service, multi-specialty hospital. A modern, state-of-the-art 200-bed acute care facility, with 300,000 patients served over 5 years, 150 nurses trained, high-technology medical procedures such as rapid DNA testing to screen and prevent the spread of diabetes, TB, HIV/AIDS and malaria. A network of trained health workers being established in villages across the district. Regular community health clinics in 58 villages serving 140,000 people. Bringing health awareness and education programs, childhood immunization and prenatal care to the most underserved of humans. In only 5 years, the hospital has successfully established a sustainable healthcare delivery system for this rural community by providing high-quality healthcare on par with developed countries, without regard to race, religion, social standing, or ability to pay, making it a model for rural healthcare in developing countries. SNHRC now embarks on the next stage of growth to become a tertiary care level hospital with a $16 million capital drive that includes a 300-bed extension of the hospital, a medical school with foreign mentor programs, technological upgrades for 3 departments, a scholarship fund for training local residents as auxiliary nurses, midwives and physicians, and a permanent endowment to provide the necessary ongoing subsidies for the care of those who cannot afford to pay. Sri Narayani Hospital and Research Centre, Capital and Expansion Drive 2010, a model for sustainable healthcare in developing countries.
The whole world is already blessed.
வாசகம் என்றாலே திருவாசகம்